Hello, and thanks for joining me again. This week is about chemo week, which is 2 out of every 3 weeks, and we begin with blood work.
Make a tight fist.
So every week before my nurse or oncologist appointment, I get blood work done. Starting to scar up where the needles go in, so I request the small needle to minimize the scarring. And we take my blood and it gets processed right away.
Little poke. 1, 2.
Nice.
You can relax your fist.
And they analyze it in an hour, and then I have a nurse or doctor appointment in an hour, and they go over my blood work and decide whether or not I can get chemo that week. So far, it's always been good, although my platelets are creeping up, which seems to be causing some clotting. So next is either an oncologist or a registered nurse appointment, but I can't really show you that because there's always a bunch of patients around. So just imagine a normal doctor's room where I see 1 week an oncologist and the other week a registered nurse. So on chemo day, we start with our pre-chemo pills. So it's chemo day. On chemo day, I have to take a bunch of pills 1 hour before chemo. I have to take so many pills, I got myself a little blister pack made at the pharmacy. So these are the pills I have to take 1 hour before chemo. And then on this is chemo is day 1. And on day 2 and 3, I have to take Emend again. And I also need my regular morning pills, which I put over there. So I have to add an extra Tylenol because the pharmacy forgot to do that. So I take 2 Tylenol, 1 ranitidine. Well, Tylenol is to, I guess, reduce swelling and pain. 1 ranitidine, which is to reduce stomach acid. 1 Benadryl, which is to reduce any swelling and allergic reaction. 1 ondansetron, which is to reduce nausea and vomiting, and 1 Emend, which is to reduce nausea and vomiting. Now, I used to take dexamethasone. There used to be 2 dexamethasone here, and then I had to take a bunch the next 2 days as well, but I'm working my way off of them. So I'm only going to take 1 dexamethasone today, and next week I'm going to take none. And then I have my normal pills, which are apixaban, which is a blood thinner, because cancer makes your blood thicker, and then you have a tendency to have blood clots. And I forget what that one's called, but that is to reduce acid reflux, because that's another side effect of the chemo. So all of these things help prevent all those side effects. Once I get off the dexamethasone, I'm just really depending on the Emend and the ondansetron to keep me from having nausea and vomiting. And so far it's working. That doesn't seem to be a major side effect of mine. So that's nice. But of course, it's going to take me a while to take all these pills. So I have a giant mug of latte tea I take it with. And then I'm off to chemo about a half hour after that, because it's just a half-hour drive to the center. So that's my chemo morning. So this is round 18, day 8, which means this is my 36th infusion of sacituzumab govitecan. She's cleaned my port with iodine because I'm allergic to the regular cleaner. And the nurse is getting everything together to, maybe over there, to access my port. So it's a bit of an involved process. Has to be
very sterile, of course. And then the port is right there. I don't know if you can see it. It's a little bump above my skin. It's been surgically inserted, and it's much easier to access that. And it goes straight into, what's this called? Vena cava? Into my vena cava, so it gets into my bloodstream quickly. And as you can see, there's a no. Okay. Yeah, just keep this pulled down. And then she's going to put in 2 salines to make sure that it's flushing well, and then she'll try to draw blood back. And I often have difficulty getting the blood returned, so we'll see how we do today. Oh, very nice. Didn't even feel it. Lots of saline. Saline number 2. You got blood returned, no problem? Excellent. So it seems that I need to be sealed at the end with something called heparin 100. And that seems to be the magic the magic piece of the puzzle that allows this blood return thing to happen. In the past, I've had to sit, sometimes for an hour, with a blood clotter, anti-blood clotter, trying to get it unclotted. And now she's going to hook it up to the system that will deliver the chemotherapy. And then she'll go off and get my bag of sausage. Hey. So this is my Sassy G, aka trodelvy, and it is in a brown paper bag brown plastic bag because it degrades in the sunlight. And they make this every day because it expires rather quickly. So this was made very recently, and yeah, goes up on the machine there. There we go. And then it drips into me. Over an hour. So I generally spend this hour doing some zentangles to keep myself occupied. And then I'm done. I used to have a 30-minute observation period in case I had a reaction or something, but I've been getting this one for so long, and I've never had a reaction, so now I don't have to do the observation period anymore.
So today my port is giving me trouble. It often gives me trouble. Last week they had to use a clot buster, and this week they have to use a clot buster again, so I'm hoping that's not going to be a regular thing. They did access my port and then reaccessed it just in case it wasn't in right, but that's not the problem. So again, gonna probably be here for an extra hour waiting for the clot buster to work. So let's finish off with a few zentangles that I did during chemo.